Without delaying any further, I want to go ahead and welcome back up to the stage Dr. Pamela Collins to introduce our second day and our first panel. Thank you so much.
Good morning, everyone. So glad to see all of you. Yesterday we had a great discussion, and today we will continue those discussions. This morning, the two panels that we'll start with this morning are focused on urban adolescent mental health. And there was a work stream in the commission focused on urban adolescent mental health, and that was the one that Dr. Tina Menzaclau and I co-led. And I'm very excited because we have one of the chairs of the commission with us to host this first session, and that's Dr. Alex Ezeh, who is the Dornsife Professor of Global Health and Associate Dean at the Dornsife School of Public Health at Drexel University. And his work focuses on urban health, population change, and models to strengthen knowledge-based institutions. He was the founding executive director of the African Population and Health Research Center, and he initiated and directed the Consortium for Advanced Research Training in Africa. He serves on numerous boards, including the UN High-Level Advisory Board for Economic and Social Affairs, and as I mentioned, he co-chaired the Second Lancet Commission on Adolescent Health and Wellbeing. So Alex will come to the stage, and I invite all the other panelists to come to the stage. And I just we're excited about this morning's conversation because it carries from yesterday's discussion about all of the mega trends that influence youth mental health, but also how cities can respond is what we want to talk about. What is it that cities can do? What is it that we can do in urban environments where the majority of adolescents around the world, where adolescents are more likely to live in cities. So cities have powerful resources, and we're going to talk about those with our panelists. Over to you, Alex.
Thank you, Pamela, and thank you very much for hosting this first, I hope, of many opportunities to disseminate the results of this commission's report. I think we did do our best to really provide a direction for what we can do collectively as a global community to advance adolescent health and well-being, because we do recognize that they are falling behind despite all the good intentions and the evidence that is there and all that. So this morning, our first session is looking at how cities and communities can help youth thrive. Our report actually identified communities as a key determinant of adolescent health and well-being, and the urban setting as an amplifier of risks, but also as providing tremendous opportunity for adolescent health and well-being. And I believe that the recommendations we have in the report on the need for multi-sectoral action, the urban environment is one place where such action could be implemented effectively. And this can be done in the design of youth-friendly services and programs and policies, but also meaningfully engaging young people in such programs and policies by ensuring equity and inclusion, even though in some settings that's like a word that we don't want to talk about, but we still have youth that are in very vulnerable positions and situations, and they cannot be excluded as we go forward. There is need for infrastructural improvements and safety, and leveraging technology in ways that can actually advance and inform the reach of programs and information that's available and accessible to young people. I think as we listen to the presentations this morning, they come from different regions of the world, we will learn what communities are doing and how they are partnering with youth and young people to advance their health and well-being, and particularly their mental health. And we have excellent panelists, 4 of them, and from different parts of the world. It's my pleasure to invite Ellen Galinsky. Okay, Ellen, please come up. Ellen is the president of Families and Work Institute and elected president of the Work and Family Research Network. Her newest book on adolescence, The Breakthrough Years, was published in March 2024, and I recommend that to you. That's really great. Ellen, welcome. So our second presenter is Wizdom Powell. Wizdom is the CEO of Youth of Unified Youth, and she's also the director of Health Disparities Institute at the University of Connecticut. She brings over 2 decades of experience in driving systemic change through data-driven policy action, place-based interventions, and rigorous impact measurement. Dr. Powell has shaped national mental health policy, led groundbreaking public-private partnerships, and worked globally to advance equity-driven solutions that creates measurable and lasting change in the lives of young people. And she will share experiences from different parts of the world that she's been involved in. Welcome. Our third presenter is, I think, will be joining us remotely from Japan. He is Atsushi Goto. He's a medical doctor and the dean and professor of the Graduate School of Medicine at Yokohama University in Japan. He leads the Yokohama Youth Cohort Study, which is an initiative, and also an initiative to create a mental health friendly city, which is an intersectoral initiative that uses data to understand how social and environmental factors impact youth well-being. So he will be joining us remotely today. Last but not least, our presenter this morning will be Manaswi Sangraula. Manaswi is assistant professor of population and family health in the population and family health department at the Mailman School of Public Health at Columbia University. She uses community engaged methods to design and evaluate culturally responsive mental health interventions in low resource settings, and she adapts approaches that have been shown to achieve meaningful and measurable results in low and middle income countries in her work with community-based organizations in New York City. And I think this is one way we can, many times we believe we are at the center of knowledge and innovation and everything, but we fail to learn experiences elsewhere that have actually shown to be powerful in the ways we can work with young people to thrive. And this morning, she will share some of those experiences as she works to serve low-income and immigrant communities and young people in the city of New York. So these are going to be the presentations, and I will call each of them to come in, give their presentation, and then we will have the panel come up here. We'll open it up for feedback and comments and questions from the audience, and I'm hoping we'll have a very interactive session this morning. So without much ado, my call on Ellen to give your presentation. Thanks.
There's a clicker. Ellen, hold on one second. Go ahead.
Good morning and good afternoon and good evening in other parts of the world like this. Okay. It's a pleasure to be with you all. And I'm here on behalf of my organization, Families and Work Institute, and the International Arts and Mind Lab at Johns Hopkins and Susan McSalmon. I'm going to share civic science research that we've done with you. There's so many things were wonderful about yesterday. As I told Pamela Collins, it's so incredibly refreshing to hear how participatory this work is, that it's not just adults sitting there and figuring out what the issues are. And we've always felt that we need to understand from the people most involved what the issues are before we begin to work together to solve them. And I have to say that historically, that's really quite novel. I discovered that young people see the world differently than older people. This was around a study I was doing in work and family life in 1985. It took me till 1999, as I told Pamela yesterday, to get anyone who is remotely interested in hearing from young people and their voices. 15 years of trying to get this formed. So our work is civic science, which means that it's in partnership with the people most involved. We had an advisory board, and we had focus groups. And what was particularly important about this work, before we started to do anything, was that young people told us that they didn't like the definitions of mental health. They didn't like the way adults talked about it. And they helped us shape what questions we would ask, including how young people 11 to 14 saw mental health, how they knew that they were okay or not okay. These are the questions that they said that they wanted us to answer. What young people want to tell adults about improving mental health. We also had their own parents in that study. So we're just early analysis, so there's not a whole lot that I can tell you about the final results yet, because we just got these data. But if I had to title them in any way, it would be adults may see things differently than young people. Let's just start with, we started with asking young people what the challenges that they face growing up today, open-ended question. And what was particularly interesting to me was mental health was 5% young people mentioned it. The top of the list, 31%, talked about social pressure. And that could have been written in the 80s, that could have been written in the 90s, I want to fit in, I want to belong, I want to be respected, those kinds of things. But the world of the digital world, the AI world, is their culture. And so some kids wrote things like, generations before us had to learn to be online, we have to learn to be offline. Or kids don't hang out. So if we've also asked parents, my guess is that they're going to see technology as a much bigger issue than young people see it. As you can see, it was 9% of young people who mentioned technology. Also interesting to me was they said they called it information overload. They didn't just call it technology. And they said, don't just teach us some little AI course, or off in a corner, or some sort of digital literacy course. They talked about, we need to learn how to use it. Don't just take it away, but we need to learn how to use it. Again, some, but not all, said that. Another thing that in a previous study that I did is that adolescents hated being called things like the anxious generation or the mental health. 38% in my previous study said, don't stereotype us, don't label us, don't define us by problems. So adolescents' voices are very important. 20% of young people, again, nationally representative in the U.S., talked about, I felt like I was doing a study in work and family life. They talk about workload pressures. It was like every adult study that I've ever done, we have too much to do. We don't know how we're going to do it. Add technology to that mix. And 12%, and I think this is really important, talked about wanting real life skills. Many of them, between a third to a half in various studies that have been done, say that they may be being prepared for college, but they're not necessarily being prepared for life. And they would like to have the kinds of skills. And they're not just talking about, the old-fashioned home economics kinds of skills. They're talking about being able to solve problems, to think creatively, to work in teams, the kind of things that employers are telling us that they want. Because the International Arts and Mind Lab at Johns Hopkins is focused on art. We ask kids about the role of art as a part of thriving. Also came up very much in our focus groups. And I think if there's a theme there, it's hidden in plain sight. It's not that we have to invent art for what kids want. They are using it. 83% said that the impact of creative activities on their mental health is positive. We asked them to define mental health, and then we asked them throughout the study to use their own definition when they answered any question. But we used the words mental health since we didn't have another word yet. And 93% of parents agreed that young people would benefit but kids are already doing it, and they were recommending it to friends who were struggling with issues. 60%, and 71% of young people participate in at least one art-based activities, usually 3. And not so many in groups. These are often things that they do themselves. And if they do them in groups, we found out that the quality of the group matters. It's not just doing it, it's whether or not it helps them feel that they belong and are respected and can contribute to the world. So let's not just say that arts activities are sort of an answer without looking at the quality of the programming. The next one is that art sounds like something rarefied. And what we found is it's not. It's sort of what you do. It's what you are almost driven to do. It's a way of self-expression. And there was a discussion about that yesterday in one of the questions. We are early in analyzing these data. We have our coding categories. But what's clear to us who are reading all of these responses and creating coding categories is that it's about self-expression. I feel free when I'm being creative. I don't feel any expectations from other people. So a lack of judgment. In the rest of the world, they often report feeling so judged. Whatever we do with these self-expression opportunities for young people, we need to listen. That's what they told us in another study. Talk with us, not at us. And we need to not be judgmental, or we'll take away the power of this. It's an antidote to stress. It helps young people deal with stress, and it helps them understand themselves better, which is, of course, the task of adolescence. A release, a way to untangle complex feelings and even discover things about yourself that you didn't realize were true. Finally, the final result that I want to share with you is that mindsets matter. Whatever we do to help young people thrive and learn, and we put those together, we need to pay attention to the way they see the world, their beliefs about the world. We have been creating, Susan and I separately, and now together, 2 different mindsets. Susan's been working on the notion of an aesthetic mindset, which means thinking creatively, being curious, wondering, meaning-making, either participating in opportunities to express yourself or beholding other people's self-expression. And that the young people with a more aesthetic mindset were more likely to be engaged in creativities and to feel positively about them. I discovered in my this study builds on 2 other iterations. It's now a longitudinal study in 2019 and 2020. I discovered by interviewing parents about a time when they lost it, that there was something that we ended up calling a possibilities mindset. And the possibilities mindset, I didn't start out to discover a mindset. I just asked parents to walk me through losing it with their kids. That is not living up to their expectations. And what I found was 3 things were going on. The first was whether or not you felt that things could change or not. That's Carol Dweck's growth mindset or fixed mindset. But that wasn't enough. The people who were talking about losing it or not losing it with their kids leaned into stress. Now, yesterday we talked about the difference between distress and disorder. Let's put stress on that continuum. Stress is when the demands exceed what you believe is your capacity to handle them, and that can feel being overwhelmed, which is the way we would define distress. And then a disorder is when it really impedes your capacity to cope. What we found is that the young people, the adults who leaned into stress, that is, they didn't think that, just take a deep breath and hope it goes away, or be mindful. They were actually thinking that they understood the symptoms of your heart racing, of feeling anxious, like when you stand up and give a talk. If they leaned into it, they actually cope much better. Afterwards, we found research by Jeremy Jameson and others that when people were taught that stress can be a challenge versus a threat, that they coped much better. We also found self-efficacy important. So that was the third part of a possibility mindset, the belief that you could figure it out. You may not know the answer now, but you think you can figure it out. We put those 3 things together into a possibilities mindset. We've created a measure of it. We tested it with parents. Their kids were doing much better. We taught it to teachers. We found out they did much better. Teaching is a stressful job, as we all know. We then just tested it in this study where we found a correlation at 0.64, which, is measuring a different thing, which we thought, wow, it was very highly correlated with lower depression and lower levels of perceived stress and more engagement in work or in school. So when we think about dealing with these issues, we need to pay attention to the quality of the program, to keeping it a zone, if we're talking about arts, and we will be developing arts programs based on this, to keep it a place where kids are not being judged, and to help kids learn possibilities so that we're downstream in helping them cope. Thank you.
Yeah, we got Wizdom.
So I want to first of all make a quick correction to the bio. I am no longer the director of the Health Disparities Institute at UConn Health. Shout out to Dr. Linda Sprague Martinez, who is gallantly leading that effort at the moment. I am currently the CEO of Unified Youth, a new national nonprofit, and I'm so honored to hold space with these leaders today. And I'm grateful for Ellen's warming the water, if you will, for what I'm going to talk about, which is a strategy that we're using at Unified Youth to build wonder ecosystems. I want to start by sort of grounding us sort of in the voices of young people that I've listened to across the decades of the work that I've done in communities, both in the US and abroad. We've already heard what I'm going to say, but it bears repeating. That young people are exhausted by our singular focus on the mental health crisis, because this constant state of alarm not only weathers our thinking and problem-solving capabilities in the same ways, it depletes our bodily systems and emotional reserves, it keeps us locked in fight, flight, or freeze responses, and it makes it nearly impossible for us to use creative thinking to generate new solutions that could truly produce the kind of transformation young people and their families are seeking. We have talked so much about trauma. I'm a trauma psychologist. I've been guilty of that myself. And woundedness, so much so that we forgot to talk about who young people want to become beyond it. So that's where I'm starting today, because young people are demanding a fundamental shift from individual pathology towards systemic transformation. They recognize that their struggles reflect broken social systems, not personal failures. As one youth told me in a fishbowl that we held in London and one in California, stop fixing and reimagining us, fix the systems and the structures. And as my mother would always say, if all the fish in the water are dying, it's probably not the fish. So another thing that affirms my suspicions and insights about where we need to go in terms of a citywide or community-based intervention are data from Hope Lab's recent research. This research revealed that young people are feeling happier, but also experiencing profound deprivation of connection. They worry about having no clear path forward. We heard this yesterday. They're facing academic pressure, fear the job market, and carry concerns about student debt. They lack a sense of safety and are deeply troubled by climate change. So why then are we treating mental health problems as exercises in self-management? Why aren't we fixing the water? What we need now, and I think all of us in this room, the choir, know that we need a holistic ecological vision, one that resists the urge to frame and treat mental health problems in that way, not tinkering around the edges of young people's interior lives, but building holistic therapeutic landscapes where young people can heal, grow, and thrive. And as scientists, we also can cultivate an evidence base that defines, designs, and implements interventions that address the youth mental health exposome, or the totality of environmental exposures and their interactions, which we know are critical for understanding human health and well-being. So working in urban communities across the nation and the world, I've witnessed firsthand how we've built, particularly in the US, mental health approaches on withering foundations. We've relied on top-down, highly medicalized interventions in ways that suggest that they are primary in our solution matrix, while we leave the environments and landscapes they navigate daily completely intact. This simply will not work, especially not in a time of a meta crisis. And it was the voices of young people that kept ringing in my ear and reminded me that I needed to fix the water that led me, when I was the chief purpose officer at Headspace, to work with city leaders to co-design a novel public-private partnership to address youth violence. In it, we sought to move beyond the individualized mindfulness training that we were so known for towards a movement for a mindful city. But residents in the city actually chin-checked us, first on the slogan. And I'll share with you that the first slogan was, love your mind, or, be at one with your mind. And one young person said, that sounds like, forgive the explication, but this is what they said, that sounds like young white women sitting in a field of lilies with their legs crossed and eyes closed. That's not who we are. We don't have the luxury of loving our minds in a place that doesn't love us back. But what we do have is a reservoir of resilience that is waiting to be tapped. We have strong minds. And so they were the ones that came up with the tagline, strong minds live in Hartford. There were a lot of learnings from this citywide intervention that I pulled forward in the work that I'm doing now at Unified Youth. But the one lesson that rose above the rest was that we needed to also, in our play, to democratize access and to build these community systems of support. We needed to also create the conditions and incentives for cross-sector collaborations, and that youth really desired something more than just us coming into the city to give them access to an app. That digital technologies was not the solution they were looking for. They were looking for something that would allow them to be viewed not as problems to be solved, but untapped wonders to behold. So at Unified Youth, where I serve as Chief Executive Officer, I'm working to scale access to creativity. And it's why I'm so happy that Ellen went before me, because she's already outlined the data that makes the scientific case for creativity. Creativity is not just about arts engagement. Creativity is actually the super skill that the World Economic Forum cites as the foundation for a strengthened future brain economy. Creativity rewires the brain in ways that are foundational to good, optimal mental well-being. But creativity also builds connection, exactly the kinds of supports young people say that they need in their lives. But as you know, it is not enough just to create access to creativity for young people. You actually have to make sure that the whole ecosystem comes together in ways that brings professionals, knowledge keepers, community, and youth together to solution and to really fertilize the ground, if you will, that can help to make progress possible at scale. And for that, we need a wonder ecosystem. So in this moment, I'm going to call us all into something that we don't often get to do in spaces like this. I'm calling you into wonder. Wonder is that feeling of awe and surprise that happens when we come upon something unexplained, inexplicable, or unimaginable. Wonder is the foundation of what young people are seeking in their lives, as Ellen has laid out. And in our wonder ecosystems, we're building really firmly on the foundation set by a set of funders that came together to fuel Art Place America. Art Place America is one of the largest creative placemaking investments in the nation. And creative placemaking is really about transforming public spaces into artistic and cultural hubs to spur economic vitality. And that creative placemaking strategy is ripe for population health application. And so at Unified Youth, our Wonder Ecosystem play is about building creative placemaking capabilities and geographies to spur better mental well-being. In this Wonder Ecosystem, we create a braided model where we have backbone organizations that work together to fuel the landscape with access to artistic expression, and we work together with healthcare systems and schools and community-based organizations to create programs and opportunities for access. But what's really important is that young people have a rapid opportunity to be referred to artistic and cultural activities. And for that, we're partnering with an organization that has launched a national movement for social prescribing. We can actually prescribe artistic outlets and activities for young people that will help them to not only get better, but to flourish in their everyday lives. But for this wonder ecosystem to work, we have to also create opportunities for cross-sector learning. So we've launched the first learning collaboratory in Los Angeles, and that learning collaboratory will bring people together in ways that create a more accelerated knowledge exchange opportunity. Because as someone said yesterday, how do we learn when we're not in these kinds of settings? That learning has to happen in place, in community, every day. And here's the thing. Communities already have the wonder that we're seeking. We have to go where they are and also create the systems of support that thread that needle. It is not like we're building something anew. Unified Youth is a wraparound organization that is going to amplify the good that is already happening and to support existing grassroots and grassroots organizations that are working at the intersection of creativity, mental health, and future readiness. Young people want us to wonder. There is also the economic case for folks who are wondering, why would we invest in creativity when we can, prescribe more medicine or have more individualized therapy? Creativity is care, and creativity is also capital. For every $1 we invest in creativity, we get a $7 return in well-being. It has the possibility to lower healthcare costs, particularly emergency room visits and unexplained and unneeded hospitalizations among young people. We can build a resilient youth community and population while also building a resilient economy at the same time. These are not the kinds of investments that you make if you're the kind of person who thinks that the only thing we have in our arsenal to serve young people are therapy and digital tech. The connections that young people are seeking are not just online. They're going to those resources because they lack them in their communities. If we build it with young people, reservoirs of opportunity and creative expression, they will come. I would also like to say that, doing this work requires you to be aligned around a set of indicators that make sense for selecting the kinds of geographies where you might mount a wonder ecosystem. For us at Unified Youth, we wanted to first target communities that had high arts vibrancy. How many of you know that there's actually an index of arts vibrancy communities around the U.S.? There is. That index became the first layer of data that we used to determine where we would go. On top of that layer, we also layered the Child Opportunity Index. We layered on top of that a terminology that came to me in my days at the Pentagon, readiness. We wanted to make sure that communities were ready for cross-sectoral collaboration because walls for collaboration need to be low enough that people are willing to exchange information and work together. You would be surprised at how ripened the ground is for this kind of work because there is no federal cavalry coming, right? The solutions that young people need are in their own backyard. So spurring new funding networks and tables, getting organizations and sectors to work together now in their communities is probably more readily available because people realize that the federal resources that once were there are rapidly dissipating. So in our phase 1, we're starting with Los Angeles. Shout out to our colleagues in LA who are working with us to build the first wonder ecosystem in the Crenshaw, Leimert Park, Hyde Park district, where they have already made a substantial investment in building one of the first, largest, I should say, arts communities through Destination Crenshaw. We're working with those leaders to create the network where young people can go so they don't have to search for where artistic activities are available. And then we're training youth creatives in that community to become certified mental health coaches because we know that there are talents in our communities among young people that are being hemorrhaged. And if we leverage those talents in a way that can actually put that talent to work, then not only will we help young people get better, we will put them in a position to actually have the training and the skills beyond crisis management to support youth like them. This is a big, hairy, audacious endeavor, but that is exactly what we need in this moment. And I think that in this room, unlike so many of the others I'm often in, you get that because in this room we have population health scientists who recognize that when you solve this in this way, you actually can create a scalable model. So I want you in this moment as we talk together to imagine a future where every young person who's facing a mental health challenge has access not just to clinical care. And let me be clear, I do believe clinical care is a part of the solution. It is just not the whole of it. Imagine every young person having access to a vibrant ecosystem of creative community-based supports. Imagine what they would be and who we might be in the future.
Thank you, Wizdom. We will go to colleague online. Is he connected? Okay. Atsushi Goto, who will be sharing experiences of what they are doing in Japan.
Thank you. Can I share my slide?
Yeah.
Okay.
You can.
Yes, great. Can you see my slides? Okay. Can you see this?
I think it's okay.
Okay. Good morning, everyone. I'm Atsushi Goto from Yokohama City University. Today, I will present a case study on Japan's youth. Japan is facing a rising mental health crisis. The suicide rate among school-aged children is at a historic high. The challenge is reaching at-risk youth before symptoms become severe. We are also seeing a growing gender gap with more increase among girls than boys. Moving to the next point, surveys show Japan ranks lowest in life satisfaction among youth compared to Western countries, and only about 53% say that they like themselves versus over 70% in the West. In Japan, school experience matter most, while in the West, both family and school influence well-being. Japan's healthcare system offers universal coverage, but it is fragmented and centered on private clinics, making coordinated care harder. This data reveals a critical barrier to first-time help seeking. While about 31% of patients with depression are willing to seek support, that number drops to only 6% for healthy subjects. This clearly shows that making that initial contact is a massive hurdle. To address this, we launched the Yokohama Youth Cohort following 3,500 young people for 6 years to identify what supports well-being. In addition, we are also interviewing youth and experts to define what makes a city mentally healthy for young people, following the Delphi survey led by Professor Collins. In summary, Japan faces a severe youth mental health crisis with high suicide rates, low satisfaction, and barriers like fragmented care and stigma. we need to shift towards prevention and proactive well-being support. Thank you.
Thank you, Atsushi. We'll go to our last presentation this morning. And that's it.
Morning, everyone. I'm really happy to be here with you all today. Yesterday was amazing, and thank you to all three of the panelists. It's been really incredible to hear about the work that you're doing. So, my name is Manaswi. I'm an assistant professor at Columbia University in the Population and Family Health Department. And just a little bit about me is that really prior to 2021, all of the mental health work that I did was outside of the US. And then in 2021, I've started working on projects based in New York City as well. So my interest is really in thinking about how a lot of these mental health interventions can really be adapted and contextualized to different populations, both in the US and outside of the US, and what can we learn from countries outside of the US in the US as well. So today I want to talk about actually two approaches to addressing youth mental health in New York City. So one is task sharing, and then the other is focused on public space activation, which I'll talk a little bit about later on in the presentation. Okay. So we know that urban areas have been linked to increased risk of some mental health conditions compared to rural areas. But there are also a lot of benefits or protective factors in urban areas, right? How many of you live in an urban area? Yeah. So in New York and DC and Baltimore, and I think a lot of you might really enjoy it as well. So there are a lot of benefits to living in urban areas. And then there's also the potential access to resources as well, right? They might not be reaching certain communities, but those resources might be there that we can really tap into. And so you'll see in that graphic right there that really the prevalence of youth feeling persistently sad or hopeless has actually increased in the past few years. So over 1/3 of youth said that in 2021. So that's quite a large number. And especially as youth transition into young adults, so that age between 18 to 25 or so is really detrimental to their adult life. And really that population of all adults has the highest rates of distress, but they access mental health services the least. So we know that that period is really important to sort of increase access for youth during that age. And youth of color especially have lower uptake of conventional mental health services. So due to a lot of different reasons, stigma, maybe not knowing where to go, lack of insurance, a lack of a cultural fit with providers as well. So it's really important to bring the services to where the youth are actually at. So whether it's communities or community-based organizations. So that's where the task sharing approach really comes in. So task sharing, which I think a lot of you are already familiar with, is mental health specialists training and supervising lay providers, so people without a mental health background, and really training them to deliver mental health services. And in the ideal world, what that does is it frees up those specialists to take care and provide services to people with more specialized needs. And the intervention that I'll be talking about specifically is Problem Management Plus, or PM Plus, which a lot of you may also be familiar with. But it's a brief mental health intervention. It's 5 sessions. It's been tested in many parts of the world. It's shown to be effective for mild to moderate distress. So I'm going to talk about how it's being applied in New York City now. Okay, so it's a beautiful picture of New York City. Doesn't always look like that, but let's put in that picture. So I really want to say that community leaders or peers have been delivering care to one another through community-based organizations. And in communities, maybe without calling it task sharing, but it's been happening. So whether that's just through, case management or financial counseling, or even more informal supports just within their communities. But I will say over the past few years, there's been really an increase in the number of studies that are trying to test some of these scalable mental health interventions that have been done outside of the US, in the US as well. In its more scaled up form right now in the US, a lot of task shared models within health systems really focus on coordination and patient navigation rather than direct services. So something that we can really think about is this idea of reciprocal innovation. So how can we take some of the lessons learned from other countries and apply them here in the US, while acknowledging that not everything might be transferable and we need to think about context as well. So that brings me to, local health is also global health. So that's a point that I want to make, that we need to start considering, the US as a part of global health. Okay, so this brings me to the Recoup project. I want to give a shout out to Brandon Port. Hi, Brandon, who's the PI of this project, and Shanair Best, who is involved in every part of this project and is amazing to work with. So I'll talk a little bit about this project that we've had ongoing in New York City for the past few years. So Recoup is a collaboration with a few different universities, including GW, the New School, and then with a lot of different CBOs, in fact, about 30 community-based organizations in New York City, and also the New York City Community Mental Health Office. So a lot of the organizations that we work with, they focus on lots of different things, but we do have some organizations that focus on serving youth. So helping out with things like job training, mentoring programs, higher education programming as well. So those are some organizations that I've highlighted down in the bottom of the slide: Living Redemption in Harlem, Riseboro in Brooklyn, and then Opportunities for a Better Tomorrow also in Brooklyn. So I'll share some of the lessons learned and highlight some of the findings so far, though we're finishing up the study sometime next year, so stay tuned for that. But what we've done so far is the staff at these different community-based organizations have been trained to deliver Problem Management Plus. And what's been really interesting is to see how PM Plus has been adapted in New York City. So I've worked on PM Plus in Nepal and in Colombia, so it's really interesting to me to see how it really fits into New York and within these organizations. So something that's been really great is that within some of these youth-based organizations, they have mentoring programs, maybe job training programs, and they're doing direct referrals from those programs into Problem Management Plus. And something that also is really unique is that these staff at community-based organizations, they already have really close relationships with the youth that they're working with. So when it comes to actually delivering the intervention, it's not like they're necessarily starting with someone new. They can kind of bring together whatever they might be working on outside of Problem Management Plus, whether that is budgeting or things around job training, and really combine it with PM Plus. And then something that's really come up, especially during our supervision sessions with the PM Plus helpers, those that are delivering the intervention, is this idea of meeting youth where they're at while trying to maintain fidelity or stick with the evidence base of the intervention. So I'll share just a few examples that I think are really interesting. So in our supervision a few weeks ago, one CBO staff shared that her and the person receiving PM Plus, the young man, they actually went to a museum together to deliver Problem Management Plus. So it might not look like this sort of conventional method where you're sitting one-on-one in a room, but this organization often takes youth out into the community. And so this is a part of what they already do. So, the two of them went out to a museum, and they were able to kind of look at art, be outside, and then also do the intervention as well. And so, she was really able to kind of stay with the intervention and talk about every step of what's going on in the session while just being in a really different space, but in a space that the young man wanted to be in. And then we've also had in other organizations where they've really thought of this program as just a part of the mentoring process. So thinking of it not as a separate thing, but just thinking of it as part of the services that they're already providing. We've also seen youth referring other youth, and sometimes PM Plus helpers have had more than one young person in a session as well. One example was that in supervision, they were talking about, two young people having a conflict with one another. So they actually both came into a session. And so we've seen this outside of the US where people bring family members into PM Plus sessions as well. So this is something that's similar. And now I want to shift a little bit and talk about, oh, okay, 1 minute. Okay. So I want to shift a little bit and talk about public space activation. So with Recoup, that's really an example of mental health services in community-based organizations, but we also need to think about the environment that youth are living in. And so public space activation projects are one way to do that. And My Block is a public space activation project that's been going on for the past few years as a collaboration with New York Presbyterian Hospital, Columbia University, and CBOs across the city. And the second iteration of it right now is called 180 Juntos, or 180 Together. So during the first round, what we did was actually in a local high school, an artist did a workshop with the high schoolers to create that beautiful mural that you see there. It was kind of around 2023. And students actually painted that together. So that goes back to what some of my other panelists were talking about. And then in this iteration of this project now, what we're working on is doing a systematic co-creation process where we have a working group that's made up of Washington Heights community leaders, youth members of local CBOs, local organizations, the Department of Transportation, Department of Parks, and they've identified this area called Quisqueya Park in Washington Heights as an area that's been sort of underutilized. So we're following a systematic process of finding out what are the needs and assets of that community, designing a public space activation project, and then doing an evaluation afterwards. So far, we've done a needs and assets assessment, and over the summer, we did an observation of, how that park was really used. And so we found that actually when people were in the park, a lot of youth were going there alone and often on their phones. So now the working group is really focusing on, what are some different activities that the youth can do together in that park. So some really key takeaways is just to consider not just clinical interventions, but also the space that youth live in. Mental health intervention delivery is feasible for youth and CBOs, as we're seeing, and we'll see the effectiveness from this Recoup project. And something that's really important is also the engagement of youth and really meeting youth where they're at, whether that's in their community or in community-based organizations. Thank you.
Thank you, Manaswi. This is one of the things when you listen to public health practice, when people are actually on the ground doing things, it's so exciting and interesting that sometimes, and it takes time to explain what is going on. So in this session, I think we have been loaned 10 minutes, I understand. So instead of finishing in 5 minutes, we have maybe about 10 plus minutes. I will open it up to ask for questions from the floor. You've listened to 4 exciting presentations, and maybe we can have 4 questions. There are mics over there at both ends. So please line up if you have questions for any particular person or all the panelists. Please go ahead.
Hello, good morning, everyone. I'm trying to make it quick. I got 2 questions. My first one is for Toshi. I hope I pronounced your name correctly. In your findings, what did you figure out, or what did the youth says makes a mental healthy city? And then my second question is for Dr. Wanda. Oh, am I correct? Yes, you. Oh, I'm sorry. I always.
Okay, Wizdom.
My question is, how can we expand the Wonder ecosystems? Because I see you already doing it in DC, but I think the DMV might be a better. But I'm not sure how you guys are doing it. But I think instead of DC, it could be the DMV instead. So how can we expand the Wonder ecosystem to the DMV just outside of DC? Thank you.
Let's get other questions.
Oh, you want them all together? So each of you has really interesting, different pieces of research and implementation work that you've done. How might they be linked together?
Maybe I'll add one question. If there is, looking at everything that you've done, and that's challenge we have in public health, that we can do excellent programs in one community and other. And if we think about scale up, how can the work that you've done in these places be taken to scale? As you reflect on this, whichever city you're in, whether it's taken to scale nationally or beyond the country to other settings. Why don't we start with Atsushi?
Sorry, I didn't get it. So could you turn to
My question was,
I can hold. Yeah.
What did the youth says makes a mental healthy city?
What are you hearing in Yokohama?
Oh, okay. Okay. So we
Yeah.
have just started the interview, and we haven't gotten the results yet. So I hope I can present the finding in the near future. Sorry about that.
No worries. I'm going to look out for those findings. Thank you.
Am I on? Okay, great. So I think the first question that you asked was, how would it be feasible to expand our Wonder ecosystem to the broader DMV area? I mean, yes, the short answer is absolutely yes. What it takes to bring a Wonder ecosystem model to a city is a funders table, a collaborative or cross-sectoral body that are working already together for population health improvement, a set of CBOs that are working at the intersection of creativity, mental health, tech, and future readiness, and young people and families who want to see the model be brought to life in their city. So the answer is it's possible. We have taken, this idea of place and tried to make it more manageable because the denominator really is important when you're trying to show effects. So we're not taking on whole of cities. That's why within Los Angeles, we're focusing in on a very bounded geography that will help us measure effectively. We have a data science team that is going to administer a bunch of baseline assessments along with relying on the evaluation metrics that CBOs and young people think are important together. So it's a little harder, but not improbable, to expand this model to a more of a region. But here's the thing: once we get a proof of concept from the Wonder ecosystem model in Los Angeles, that will give us the data and the confidence that we need to scale what's working, to other places. I think when we talk about scale, it is important that you know that what you're scaling works before you scale it. That's why we're not all the cities that are on our roadmap, which are Washington, D.C., Charlotte, North Carolina, Chicago, Illinois, Tulsa, Oklahoma, Memphis, Tennessee. Like, we're going to go to all those places at once. We're starting in LA, going deep there, and we're going to learn a lot from this incredible group of leaders that are already around that table. I think how my work, I think I heard a lot of linkages between what my colleagues were sharing, because public space activation is a central force of creative placemaking. Obviously, that kind of a intervention or component of every Wonder ecosystem play is going to be important, and we will be doing public art projects and murals with youth and communities and families. We want young people to see themselves as part of their communities. We've all been in those communities where young people's play and imagination aren't welcome in all of its forms. So we have to create those spaces, and that public activation piece will be important. I am really excited that we're talking about partnering with the NeuroArts Blueprint Initiative and with Susan and her team to do something even more elaborate with respect to priming young people for an entree into the science of neuroarts and neuroaesthetics. And I think that's also an important part of the component and the play. So the other thing I want to say is that when you're doing ecosystem work, I think you have to invest for the long haul, which is why we created the Wonder Fund, which is a national catalytic investment vehicle that will allow us to stay in communities for a decade. Think blue zones, right? What does it take to create a zone where young people are not just feeling better symptomatically, but they're flourishing beyond what we expect? That takes deep investment, a longer runway to prove effects and impacts, and systems and supports that continuously refine for sustainability. So I think I've answered all the questions.
Mark gets it go. I'm going to talk about something a little different than I talked about in my presentation, but we'll take it back to the presentation. I have been, for 25 years, found the research on executive function and the skills that grow out of executive function very compelling, because they are not only linked to academic success, but they're linked to life success. They underline all learning. So the basic brain processes of executive function skills underlie creative thinking, critical thinking, setting goals, perspective taking. We talked about empathy, but those sorts of things. I have been partnering with AESA, which is the school superintendent organization, now for 4 years. So the intervention that I'm going to do with the University of Minnesota, my organization, Families and Work Institute, and AESA took about 4 years to get to where we are now. 2 weeks ago, we held a conference bringing the best neuroscientists together with school superintendents. They were blown away by each other, basically. It was, again, civic science. And our goal is to, AESA has made real skills for real life, given the portrait of a graduate work that's going on around the country, given that's what business wants, given that the sensitive periods of development are the early childhood years and adolescence. We are working toward both real skills for real life, which is one of their tenets, and measure what matters as being a part of every school. We will have people in every district in the country, so we will scale. We're starting out, we take the materials that we developed at the summit, and we're going to develop a training program, which we're going to do in 11 parts of the country and do rapid cycle evaluations next year, and then spread it out as it works. So we're trying to use a different place, the schools. In the partnership that we have with Johns Hopkins and the International Arts and Minds, we would like to add an neuroarts component to that, so that there are an expansion of what we're looking at. It is very much a part of real skills for real life. So watch out, here we come.
And then on the question about scaling up, I do think it's really important, but at the same time, I think we want to think about not just reach, so not just the number of places where we're scaling it up or the number of organizations that we're working in, but also thinking about quality and the quality of care that's being delivered, and then also collaboration throughout. So making sure that if something is going to be scaled up, everyone is on the same page from the beginning, and then that leads to successful scale up. So really thinking beyond reach, I think, is really crucial for thinking about scale up.
Okay, we can take 2 more questions. I think there was a hand over there. Hello, sir. You still want to ask a question? And then,
So my question is I know there's a really big science called implementation science and scaling. And is this an area of expertise? Now I'm going to be a little parochial of the Hopkins School of Public Health. And can it be something where maybe Hopkins continues or expands on its leadership and kind of finds all these pockets of excellence and then systematically helps drive expansions of selected things? That's just me.
Okay. So, Dr. Powell began to answer part of the question, but it's for everyone. So one of the challenging things about doing city level work or work in a specific geography relates to workforce management and the infrastructure for sustainability, separate from the funding, because there's also a science of the people you're working with. Can you speak to that? And challenges or insights that you've learned? And this also goes for Dr. Goto as well.
So I'll be quick. When we were, this is a story not of a success, but of a real challenge we faced in the city of Hartford when we were building this movement for a mindful city. We came together with city leaders there to unlock access to the app and resources there, and we also created these collaborative circles among organizations to work together to provide the wraparound training and support for how to use the app, what was there, and creating a more, I would say, group-based use of the resources there. So we thought we had buttoned it all up. We used the city to leverage their ARPA funds to create this access point. And then we had a political transition. Now, I should know from my days in the Obama administration that political transition years are terrible times to do, not new things because, there's the outgoing person and their legacy and the person who's coming in who want to create their legacy. What we didn't do is what we're doing now in Unified Youth, which is take the long road to building the stickiness in communities and really doing a broad-based needs assessment and also assets mapping exercise to determine where there are people, where you find your people in that ecosystem that will ground that intervention. And then the other thing was that it was short term. So it was a 2-year, runway. And it takes a lot of time for people to build trustworthiness, someone dropping an app from the sky saying this is something that's going to be great for you. That doesn't work. People have their misgivings, and their misgivings are grounded in an unfortunate reality, the harm that has come to communities largely of color and who are disenfranchised. So you have to build a runway, I think, and the funding model that matches that to build the infrastructure for the long haul, which is why we've committed a decade. And people are saying, you're going to stay a decade. We're staying a decade because it takes that long for you, one, to see impacts and outcomes. And secondly, for you to build the trustworthiness, to have all the trials by fire that happen when you come together with cross-sectoral leaders who have different incentives and different motivations, you really have to do the hard work of building those relationships and on-ramps. And the infrastructure, as you said, isn't just economic. It's also community infrastructure, care infrastructure, and we're creating braided systems. That takes time. And I think funders, and where I sit in nonprofit land, have to move from this sort of restricted funding that gives you, 2 years to do your work to unrestricted pot of money and trust the community. Trust them. They have the wonder, right? They have the access and the proximity to the peril and the promise. And we have to be willing to rise up to meet them at their highest intentions for that kind of holistic healing. We just haven't really built the systems around the work that's necessary to cultivate what you're talking about. But yeah, it was a tough lesson because we didn't have as much uptake as we should have in that city, and it was because of all of the challenges that you so poignantly highlighted.
Did you want to? Actually, I'm going to cede my time to Dr. Goto so that he can tell us a bit about what it's like building these same kinds of coalitions in Yokohama City.
Okay.
Thank you. So we think that it was relatively easy for us to make this kind of partnership with Yokohama City because we are Yokohama City University, so it's funded by Yokohama City. however, until recently, it was quite difficult to collaborate on this kind of project to do research together because they didn't recognize the necessity of doing research. They just do like something like that. But now we are on the same page. They recognize the mental health issue in youth, and we have started the cohort study together and also the interview survey. So we hope that given the finding from these surveys, we are going to we can make the action together to tackle the problem of mental health issue in youth, starting from Yokohama City. Thank you.
Thank you. I'm being informed that our borrowed time is over. So we have to end this exciting session, unfortunately. But I think there will be break time and all the speakers will still be available at the break time and lunch. Please grab them and make sure they answer your questions. Okay, thank you, Pam, and thank you all for your presentation.